China tackles rising student obesity with new guidelines, by Satori News. In a strategic endeavor to tackle the escalating concern of obesity among its youth, China introduced a set of comprehensive guidelines aimed at addressing the well being of primary and secondary school students. This comes amidst growing concerns over health impacts due to weight issues among school children in China. The initiative, outlined as the Technical Guidelines for Comprehensive Prevention and Control of Overweight and Obesity in Primary and Secondary School Students, represents a collaboration between several governmental bodies. These include the National Disease Control and Prevention Administration, the Ministry of Education, the National Health Commission, and the General Administration of Sport of China. The guidelines highlight a multifaceted approach, focusing on prevention, early intervention, and the implementation of an early warning system for obesity-related diseases. By zeroing in on these areas, authorities aim to stem the tide of increasing obesity rates that have been identified as a barrier to the physical and mental well-being of young students. One of the key elements addressed by the new measures is the promotion of healthy eating habits within the educational setting. This includes advocating for reduced consumption of salt, oil, and added sugars, and the provision of science-backed intervention methods. An essential component of this strategy is the directive for schools to employ qualified nutritionists who can spearhead the execution of these nutrition-related initiatives. Recognizing the importance of physical activity as a cornerstone of health, the guidelines recommend ensuring that students engage in regular exercise. This is to be facilitated by mandating at least one physical education class daily, thus instilling a culture of fitness and movement from an early age. Health screenings are poised to play a critical role in the controlled strategy, with the introduction of regular evaluations and the establishment of health records for all students. These measures are designed to provide timely feedback to both students and their parents, creating a continuous loop of monitoring and response geared towards maintaining optimal health standards. In an innovative move, the release of a self-assessment form for overweight and obesity risks will empower families and schools to conduct assessments. This tool is to be used under the guidance of health professionals, thereby contributing to the larger vision of informed self-management and awareness in terms of weight-related health risks. The guidelines are set to be a significant step forward in the prevention and control of obesity among Chinese students. By combining early intervention with persistent health education and active lifestyle promotion, China demonstrates its commitment to safeguarding the physical and mental health of its future generations. Thank you for choosing Satori News.